and they came for the whole abdomen, the entire abdomen to the left side of the stomach is swollen. So you can feel it by touch. Outside that, medical personnel do what we call the CT scans and MRI. When Farm Chilaka comes on board, he will be speaking extensively on these particular test types. Now, one thing we must understand is that a normal healthy spleen is around 12 centimeter long and 70 gram in weight. How do we get to know this? During a scan, it is easily to measure the length of a healthy spleen. But when it becomes enlarged or when it starts enlarging, it can get up to 20 centimeter long and 1,000 gram in weight, and even more when it becomes highly inflamed. So we're going to see all this in today's class. Now, if you look at the diagram in front of you, you're going to see clearly a normal spleen to your left. Now, you can see the direction it takes when it begins to enlarge. So let's look at the diagram in front of you again. You're going to see a normal spleen. So your listening to today's lecture is really going to diagrammatically inform you on where your spleen is and the direction of enlargement. So looking at the diagram, you can see the direction of enlargement. That is why when you find either a child or any patient with an enlarged spleen, you are going to see to the left section, it is protruding outward, really making the person's shape look very abnormal. So now what can cause splenomegaly? If we look at one major cause is liver disease. And in one of my lectures on malaria, I spoke extensively on the various, on the cycle of malaria and two stages, the pre-erythrocytic stage as well as the erythrocytic stage. One particular stage occurs in the liver. So malaria, as we're going to see as we move on, is a major trigger to splenomegaly. Why? Because once you begin to have a diseased liver, and by extension, having more red cells that are infected, as we're going to see later, you're putting the spleen at an, danger, it's a danger signal to the spleen. Why? Because it has to do a lot of filtration. It has to do a lot of fights, releasing more white blood cells, producing more white blood cells to attack. So, and when the spleen begins to work in excess, it tends to show it by becoming inflamed at some point. And in malaria, the pre-erythrocytic stage or phase occurs in the liver, where the liver parenchyma cells are greatly attacked. And you now find the pre-erythrocytic schisms developing up to a point they now migrate to the red blood cells, where they now continue the second phase, which is the erythrocytic phase. So you now have both the liver and the red blood cells on malaria. So some of you listening to me that you say, malaria is a Nigerian sickness, it's a common thing, it is part and parcel of us. Please think twice again. Malaria is no friend. Malaria still remains the #1 killer in the world today, especially in sub-Saharan Africa. So if we begin from this lecture, you begin to see the link between malaria and the development of megaly, that is an enlarged spleen, then you need to cross-check or double-check whenever you have malaria. Another causative agent is what we refer to hematological causes. Let's look at some hematological causes. Number one, let's look at hematologic malignancies. We've looked at malaria as #1. Now we're looking at some hematological causes. and number one on our list of hematological causes is hematologic malignancies. A good example is leukemias. Leukemias, we have chronic lymphocytic leukemia, CLL, and we have chronic myelogenous leukemia and others. So you have this leukemia where you have excess white blood cell production, as well as lymphomas, where you have different types like the hairy cell leukemia, splenic marginal zone lymphoma, and others. All of these play a prominent role in enlarging your spleen. I might not want to spend too much time because we have just limited time. Then the next one is what we refer to as myeloproliferative disorders. Good examples are chronic myelogenous leukemia, which is increase in abnormal white cells in the spleen. Increase in abnormal white cells. So we are now having white cells that are increased and they are even abnormal. And because of their presence, you now find the spleen reacting. One thing with the spleen is that while performing its job, once there is an excess work on the part of the spleen, it reacts. And if the excess work continues non-stop, it begins to inflame. Now, another myeloproliferative disorder is primary myelofibrosis. Primary myelofibrosis. Now, this is another condition that can enlarge the spleen. Why? Because there is scarring inside of the spleen. There's scarring where this inside of the skin begins to scar, like a corrode or erode, and that alone can affect the spleen. Please, I would like to know if I'm being heard. Hello, please, if you know you're hearing me, can you go to the back corner and say yes?
Yes, doctor, we're hearing you. Go on. Yes, doctor, we hear you very clear.
We are hearing you.
Yeah, thank you very much. Another myeloproliferative disorder is polycythemia vera. In polycythemia vera, we find patients having increased red blood cells. And once there's an excess red blood cell, it is a major problem. That's why most times when the doctor check and feels that somebody has an increased red blood cell, you'll be required to go for a blood check where your part cell volume is, that test is conducted. And we have normal range for males and normal range for females. So where we now have a situation where your packed cell volume is far and above the normal range, it means you are having increased red blood cells. Increased red blood cells. When there's an increased red blood cells, it does not help your spleen at all. So why? Because your spleen will be working working harder in order to reduce the increased blood volume as a result of increased number of red cells. And as a result of this, the spleen can become enlarged. Another one is essential thrombocythemia. And this one too has a way of increasing the spleen. Why? Because it has to do with increase in the number of platelets. Increase in the number of platelets. So it's either we are having increased number of white blood cells or increase in the number of platelets, as we have seen in essential thrombocythemia. So in all of this, it affects the spleen. It affects your spleen. Now we have other hematological disorders like autoimmune hemolytic anemia, hereditary spirocytosis, as well as sickle cell diseases. We have dealt in some of our previous lectures on sickle cell anemia. So, and in sickle cell diseases, the red cells, majority of their red cells are sickled. Majority of their red cells are sickled. And because if you go back to that lecture, we talked extensively about how these sickle cells can be so, they trap themselves because they are gummy. They trap themselves within the blood flow canals. And because they do this, you now find the spleen working extra to get them out. Why? Because the red cells are abnormal. And while the spleen is busy doing all this, you now find the spleen getting enlarged in the process. Now, other situations that we see again is infections. Infections like mononucleosis, tuberculosis, HIV, and so many others like that tend to enlarge the spleen. Why? Because the spleen will be releasing more white blood cells to serve as your soldier cells to attack these non-cells. So it releases what we refer to as an immune response. In immunology, there are processes. It's a very beautiful course, immunology, where you are taught how the body defends itself. So you find out that situations like the human immunodeficiency virus, HIV, or the tuberculosis, the organism responsible for tuberculosis is Mycobacterium tuberculosis. It is the sister to Mycobacterium leprae, which is the causative agent for leprosy. Now, whether we like it or not, Mycobacterium is not a friend to anybody. If you look at those with leprosy, you can see how Mycobacterium leprae can damage somebody's body, let alone Mycobacterium tuberculosis, its sister. So, and once people get with any of these infections, you might find the spleen doing a human's job to get the person back on track. And in some cases, the spleen gets inflamed in the process. Earlier, I had told you about liver diseases when I was talking about malaria. And for those who missed our lecture on malaria, I will kindly suggest that lecture. It was quite educative so that you get to see how malaria can predispose you to having an enlarged spleen. Now, there are other things we really need to look at concerning the spleen. Now, I told you earlier that the spleen normally removes all damaged or abnormal red cells from circulation. And because it does this often, you now find him either having an increased workload. And once there's an increased workload, you now find the spleen enlarging in the process. There is what we call work hypertrophy. Work hypertrophy can equally lead to enlarged spleen, especially in cases like hemolytic anemias, hereditary spherocytosis, and sickle cell anemia. I've mentioned all of this one. So there won't be need for us to go back there. At least in a nutshell, we have been able to see some of the predisposing causes to enlarged spleen. Then let me reiterate this fact that as a human being, if you go for a scan, it is easy for you to determine whether your spleen is of normal size. It's very, very easy. All you need to do is to just go for a scan for a spleen check. Once it is measured and it is less than 11 centimeter, then you have a good spleen. Now we have what we refer to as moderate splenomegaly. Moderate splenomegaly, where your spleen has enlarged, but in a moderate form. And once the measurement is taken by the sonographer, and it is found that your spleen is within the range of 11 to 20 centimeters. So once your result comes out and your spleen is within this 11 to 20 centimeter, what you are looking at here is moderate splenomegaly. Then we now have what we refer to as severe splenomegaly, where the length of this spleen is greater than 20 centimeters. And by the time they do a weight check at this stage, we might be looking at 400 to 500 grams in weight of the spleen of that patient. And it's really, really bad. We've seen cases where even the weight goes as high as 1,000 grams. So in this case, we are looking at massive splenomegaly, Just like I said earlier, a ultrasound or a CT scan can be done in order for doctors to ascertain the level of enlargement. When Fantila comes, he will be speaking more on that. Now, if we look at the global incidence of splenomegaly, globally, the global prevalence is around 2%. A lot of us might say, well, this percentage is quite small. But believe you me, if you are looking at the incidence rate in Nigeria, which is the same 1 to 2% in rural areas, if you look at that small percentage, it's really, really massive. Now, if we look at the total cost for enlarged spleen in Nigeria, the one that tends to be more is the one arising from malaria, the one we refer to as hyperreactive malarial splenomegaly, HMS, hyperreactive malaria splenomegaly. Now, if you look at this term, just like I had explained earlier, malaria is the one causing the bulk of the enlarged spleen we see in Nigeria. Malaria, malaria, malaria. I'm repeating it 3 times. Why? Because we take it for granted. And when you take malaria for granted, it comes in different forms that you might not link it to it. So please, this lecture is coming to us courtesy Superlight, and we are really very grateful that we are getting this information. Now, I've said it before and I'll say it again. Malaria is a major contributor to splenomegaly in Nigeria, especially HMS, hyperreactive malaria splenomegaly. Then sickle cell disease is another one. It accounts for approximately 21%, while that of malaria accounts for close to 45%. So we have this percentage for the ones some other patients develop. Now, I've told you that some of the symptoms you might feel is that the upper left abdominal section is painful. That section is palpable. You can feel it with your hand unless it is not enlarged. But once it is enlarged, you can feel it. The patient always complains of loss of appetite, and whenever he or she eats, the patient can tell you that my tummy is full, even when it is only little the patient have taken in. So the patient will always say there's this early fullness when taking meals. And in some patients we see anemia. In fact, a lot of patients come down with anemia, and there's a lot of weakness and fatigue, while some come with colds, other infections, bleeding, and so many other things that are associated with it. It's no friend to anybody. And courtesy Super Life, we are now seeing how somebody's spleen can become enlarged. Today's lecture can now afford you the opportunity for you to go for an abdominal ultrasound in order to check to know so that you can go back home and continue to live healthily. There are some health habits that equally predispose you, especially those who take alcohol a lot. Please, we want you, if you cannot stop, do your best to reduce it to the barest minimum. Those who smoke, don't forget tuberculosis is a very strong disease that is associated with smokers. And you know, we have mentioned this earlier. So we've given you the basics, So at this point, I want to invite my brother and my friend, Fam Chilaka, to take us through the diagnosis and test, while my big brother, Dr. Chut, will be coming in for the treatment, which will equally be wrapped up by our wonderful Coach Samson. So at this point, please kindly permit me to invite our Fam Chilaka, are you there? Hello, Fam.
Sir, yes, I'm here, sir.
Yeah, please, you have the floor.
Okay, sir. All right, good evening, everybody. Thank you for having me here this evening. I don't have much work to do. I think the major points have been elucidated by Prof. Right? Basically, you're looking at an enlarged spleen, and of course, we know that the spleen it's a very vital organ in between the diaphragm and the stomach, and that the spleen is so important to us because if your spleen is affected, the entire defense system could be at risk because the spleen is the source root of the white blood cells, the lymphocytes, which are a major player of your defense or immune system. So it is important that we take these lectures very, very seriously. And so if the spleen is unnecessarily enlarged, which could be caused by various factors which have been fully elucidated, especially viral infections or bacterial infections, as the case may be, right? Whichever the case is, it's important that we take this seriously. Now, the spleen, when the spleen is enlarged, when we say you have splenomegaly, first of all, it is even very, very, it becomes conspicuous because when the size of the spleen enlarges, sometimes it could even encroach into other organs, and it is also protruded that a proper physical examination, right, could be able to fish it out. Now, so what happens is that your HCP, the healthcare provider, will basically ask you symptoms. What are the symptoms? These are basic questions that your HCP will always ask. For any diagnosis to be done, there must be questioning or probing in the place of clerking, right? You are asking questions like, what kind are you, where do you experience the pain? They will tell you to point at that place. When you point at that place, if it is between the 11th and the 13th rib, then it becomes, it could be suggestive for somewhere around your spleen. Now, why they are also asking, because the symptoms that will be presented may not be specific for spleen, right? There are symptoms. The symptoms that you may have might basically be problems associated with your stomach or any part of your abdomen, right? That is why it's not going to basically rely on the physical examination, right? So there is also need It's not going to rely squarely on your answers. So it's also going to have a close look at your abdominal region, all right, especially just at the side of your stomach, right? And when you see that protrusion, it could be suggestive for an enlarged spleen. And it's not something that is very common because it is usually associated with cancers, especially leukemia. Leukemia is a cancer of the lymphocytes, which are the white blood cells, right? And the white blood cells are actually produced in the spleen. The spleen is the production site for the white blood cells. And like I said, the white blood cells are involved in your body immune system. That's your body immune system. And as such, patients or persons who could have, this disease could actually be triggered by an autoimmune reaction. Yeah, I know Prof must have mentioned that, an autoimmune reaction, because it is actually the site where the immune cells are actually being produced. And so you may have a problem there where they begin to fight themselves, and as there is an autoimmune reaction, you may have an inflammation of the spleen or enlargement of that region. All right, and that's autoimmune reaction could also give rise to proliferation or movement rather of bacterial cells or opportunistic microorganisms into that region to also further enhance the enlargement, right? So he has to now look at that part of your body, and they know the region of the ribs where that spleen is. So if they look at that part of your body and they observe that there is an unusual growth or an unusual enlargement of that part of your body, it may now suggest to them that, okay, this may likely be the spleen enlargement, right? Enlargement. And of course, for them to be double sure, they are not going to rely squarely on the physical examination. They will take a step further. And the step further is to do basic imaging tests, the CT scan or MRI. So what the CT scan will do is to basically narrow that location, that site of interest, all right? That will ultimately amplify that region and bring to bear what could be going wrong there, right? And if it is the spleen that is the problem, it fishes out, right? It also may also show the HCP, right? The severity of the damage or the severity of the enlargement. They have a way to measure them. And I believe Prof had mentioned them when he was discussing it. So I don't need to stay much on that. Now, why the imaging test is important is because, you see, when you just look at the human body is like a machine. It's like a vehicle being built up. And the truth is, for those of us who are Christians, the more I look at the anatomy, of the human body, I see more reasons to glorify God and to believe that indeed God is omniscience, right? Nobody can create another human being except by these artificial methods of clonings and all that, right? But even if you are going to do a clone and all that, you still need is it a progenitor? You need something to create it, and that thing you didn't create it yourself. And so why I'm buttressing this is the sophisticatedness and the compartmentalization of the human body is beyond, is out of this world. It's not what man can think or do. It's something similar to what we have in our vehicles. See how the engines are connected, the components of the engine, the wires, the cables, every part of the vehicle has its connection somewhere. And that's the way the human body is. That is why when one part of the body is affected, you'll be so shocked that it may encroach into others, right? And so when the spleen is also affected, or when there is a suspicion for the spleen enlargement, it's important the imaging test is done. Why? Because it may have also encroached into other organs. It's just like you have, what example will I give now? You have a tree in front of your house. You planted a tree, right? And the trees you planted the seed, and the seed grows and begins to grow until it turns to a tree. But it's in front of your house, close to the roof of your house. As the tree grows, what happens? It will look for areas where it will encroach into. You get what I'm saying? So it may even break the roof of the house or damage a section of the building, because the tree has to grow and it has to keep growing. So that is the same thing that happens to splenomegaly. When you have an enlarged spleen, as the spleen enlarges, right, it will find a place to express its growth. And that means it may encroach into some other organs, even the liver. It may encroach into other organs. As it's growing, it may encroach into other organs, causing other organs to have problems too. So even though it's the spleen that had a problem, it could also affect other nearby organs. And this is like a machine. So all the organs are connected. Like I said, the spleen is just in between the upper part of the stomach, and the diaphragm. Do you get what I'm saying? So it means that it can easily affect the stomach. It can easily, because if there is a push, if there's an encroachment into the space of the stomach, it may also affect the elasticity, of the stomach, right? Causing other kinds of problems. And even the intestines could come into play because you're having an organ that is unnecessarily enlarging beyond its normal proportion. So that is why the imaging test is very, very important, so that they will be very sure of what has gone wrong, if it is just within the spleen region or there are other damages associated with it, right? So so that is the reason why you run the MRI and the scans. And then the blood test is also done, because if the spleen is being enlarged, what could be responsible for that enlargement? So a sample is being collected, and you run what's it called? A culture. The culture test, or even a simple blood test, right, will also tell us if it is a bacterial infection or a viral infection that may have caused it. The reason is because being able to identify to isolate the microorganism or the bacteria that may have caused it will also help to manage the infection, while you are also addressing the enlargement.
Hello, Pam. We can't hear you again.
Yes, I was disconnected at some point, but I'm back now.
Awesome.
Yes, it was network. So while the excuse me, please. So the blood test will now narrow the diagnosis to what microorganism could have caused that problem. So from the blood test, they'll be able to isolate the microbes, right, that could have been responsible, and also know if if it is also cancerous, right? Because cancer is a major proponent of splenomegaly. Cancer is especially the blood leukemia, right? Leukemia is a major problem. So they also need to do the isolate to know if it is even malaria, if it is a plasmodium parasite that is responsible for it. Because if you have an untreated plasmodium parasite or untreated malaria, where the plasmodium has also, have a spread somewhere. The parasite is present in the liver cells, the hepatocytes. So you may have a spread where the parasite could also become opportunistic, in the sense that the problem may have been caused by the bacteria, and by the bacteria begins to attack the the spleen. You may have the parasites coming in, invading that area and also increasing the problem, causing more enlargement. So it could be caused by malaria. And if it's caused by malaria, it means the HCP will also need to find a way to get rid of the parasites, that may have caused it. So that is the importance of the blood test. So a lot too can also be found, and also to check for certain proteins. There are certain secretions and proteins in the blood that will also suggest for other organs that could have been affected, right? Organs like the liver, organs like the diaphragm, organs like the stomach. There are certain proteins that are associated specifically with these organs. So the blood test will also reveal which organs could have been affected, right? Or could have even been the source of the problem, right? Okay, so that is that on that. And then the bone marrow analysis, basically this is still to test for the blood. So let's go straight to the test, rather the treatment. How do you now treat? How do you treat this problem? Now, before I round off, so that my people will come in here. Now, for you to treat this problem, first of all, is after diagnosis, you have been able to identify the root cause. If it is a viral infection, then you have to use antivirals, right? There are various antivirals that the HCP may find useful in managing this situation. If it's a bacterial infection, you also look for antibiotics, right? That are also very, very effective in dealing with such a case, right? You have to get rid of the microbes, right, by using the appropriate antimicrobial, whether an antibiotic or antiviral, as the case may be. And then after which, you also look at how do you now manage the enlargement. If the enlargement is so bad that it has gone beyond the management or so, then it may have to be excised, and that means the person will go through splenotomy. So the splenotomy. So the surgeon will have to find a way to remove maybe the damaged part of the spleen or replace it, right? But that's an extreme case most of the time, especially when it is caused by cancer, And so when it's not easy to manage, because you are looking at a region where the white blood cells are being produced. Because what happens is that when the person is having this problem, you become very, very predisposed to a lot of infection. You become very vulnerable and susceptible to a lot of infections. And then you can have all other opportunistic microbes, opportunistic infections, take advantage of the situation. And you have a lot of infection. You can be multiply infected. So you are treating various kind of infection both at the same time, because the spleen is having a problem. So your immune system is down. And as such, of course, for them to also treat you, now bring in immunosuppressants, right? The immunosuppressants will come in. Excuse me. You need the immunosuppressants here, because especially when it's an autoimmune situation, you need the immunosuppressant. They are there. And of course, if you're also using the immunosuppressant, automatically, you're also going to even play down on your immune system. So the defense mechanism is also affected even while you are managing the situation, pretty much. So in most cases, you now have to place the person on certain immune boosters after quick, so that you'll be able to boost the patient's immune system. Hence, while you are managing the patient of this problem, the patient could also come down with other kinds of infections, because the immune system is down. Now, this is where this is where you have a problem, or this is where we have our advantage. Now, this Super Life STC30 is basically an immune booster. And I think last week or 2 weeks ago, I was able to mention quite a number of components, you know, very essential minerals and stem cell components that we have in the Super Life, especially the STC30. So basically, what did you do? The STC30 is that it is going to radically, please underline that word radically, it will radically improve the immune system. Because now your defense mechanism is down. It's like a town, a community that has been affected, that has been invaded by terrorists. And then the terrorists did not just affect the community. They went straight to the barracks, the army barracks in that community, and they brought the barracks down. So if the barrack is being invaded, what happens to the civilians in that community? That's exactly what's happening. So it means if I am going to solve the problem, what do? I have to first of all reinforce the military. I have to reinforce the barrack, build the barrack again, get my soldiers on ground. So that's exactly what the Super Life will do. It will go back to the barrack, rebuild the barracks, and then get the soldiers to get to work. So that's exactly what the Super Life will do. So because now you are having a complete suppression of the immune system. So what do? If I can build up my immune system, it means the body will be able to fight against those viruses or diseases or bacterial infections that has kept it down. Because what is bringing about the enlargement are these infections. So I need the immune system to be up and running. So what it means is that you can comfortably, very comfortably, combine the SC30 alongside the antibiotics or whatever the HCPs could be giving you. Do you get what I'm talking about? So while the antibiotics or the antivirals are getting rid of the virus infections or the bacterial infections, you have the SC30 helping to boost the body immune system, to boost your immune system, and that will give you a complete treatment. That's a total treatment. Okay, so I will leave it at that and allow my bosses to take over from here. God bless you.
Thank you, Farmer. Thank you. Please, can we just give both Farmer and Dr. Rose, I beg you, 10 fire emojis. You know, it's not easy from the medical background where they are an authority to be at least they are coming out sincerely in the real way to take any elements, more especially like this one we are discussing and the previous one we have discussed, taking them headlong from the root cause, not cutting the cutting it from the top, but from the root. Please do me a favor, give them 10 emojis, which is 5-5, because of course you could say that the meeting is 100% free just because they decided to make it free. And God will surely reward them. And I believe God, you too, He will be praying for them. I know in a no distance time, even our corporates, we really, of course, they are watching, they are seeing. So thank you. So I know that Dr. Chooks couldn't assess based on where he is. He has been in one kind where he has a primary duty as an analyst in one kind village in Edo North. But I know that Coach Sampson is around, who could, these 3 items, these 3 combo, I call it combo, specifically for tonight's topic. So Coach Samson, are you there? Please just do a summary of it.
Yes, I'm here.
Yeah, in the next
Wow.
few minutes. Yeah.
Good evening, everyone. Live is super. Thank you so much, Dr. Egbe and Fam Chilaka, for that extensive lecture on the nice topic, the enlargement of this spleen or enlarged spleen. Like they have said, spleen is a very pivotal, element in the immunity or immunology or whichever you want to call it. So, and that's why you see that most people that has a sickle cell anemia patient, some of them used to have what we call infection of the spleen, and where their urine will be like coke. You know, when you see a sickle cell anemia patient, spleen and his urine is like coke, is due to the inflection of the spleen. And that's why you see most times they are prone to so many other medical, illnesses or challenges, because most times they also have infection of the spleen, which means that their immune system will not be able to defend them against any viral or any kind of pathology or or any kind of viruses which attack them and makes them become sickler. That's why you call them sickler, because they have infection of the spleen as well. Their immunity is no longer functioning as the way it will be. And thank God for Super Life that provide solution to these challenges, where we have a plant-based stem cell product that has the ability to either repair any damage to the spleen and make the immune system to be able to, or the white blood cell to be able to function well as it should be. And you have the combo here, the SCC30 being a plant-based stem cell product that has the ability to repair damaged cells. It can activate the dormant one. It can replicate or rejuvenate cells, and it can also reverse any damages to tissues or cells or organs, and also it can regenerate a new cell of the body, and it can also improve the immune system. It can improve the immune system of the body, and this is a very perfect treatment for the challenges we are treating today. And coupled with the SIC, which is basically a combination of powerful antioxidants that has the ability to boost immunity, particularly because the problem we are treating today affected the spleen, which is the main ingredient or main, in the immunology or immunity or the white blood cell, which is the hallmark of the immune cells. Now, so we have a special product or a specialized product that's been proven so effective in boosting immune system. Not only boosting immune system, it has the ability to fight any kind of or reverse any kind of infection. When enlargement is also a kind of can cause through infection, can cause enlargement, and so many other factors can cause the enlargement of the spleen, like some pathogens, like Dr. Rose talked about the that can also cause the enlargement of the spleen. So being is an immune booster or a product that has the ability to boost the immune system, also fight biological imbalance in the body, and also, does a lot of functions in our system. Permit me if I can share my screen briefly. So, like we said, we have SC30, which is a plant-based stem cell that has been proven to have the ability to work on the root cause of the problem. The root cause, that is the real game changer. Working on the root cause, not working on the symptoms. So, irrespective of what the symptoms might be, or irrespective of what are the likely factors, like Dr. Rhodes has mentioned, there are likely factors. There are different reasons that can cause enlargement of the spleen, irrespective of what causes it or what kind of risk factors or the symptoms. The medical personnel might detected the cause of their test and so many other diagnoses. SC30 being a stem cell product has ability to reverse any this kind of problem, and it does it from the root cause. That is because it has the ability to work on the cells, and we all know biologically that a cell is the smallest basic unit of life. The cells becomes tissue becomes organs, organ becomes the system, and system becomes the entire human function. So, like we said, SC30 or Superlife product has ability to improve and optimize your health and your well-being. So, apart from improvement, in the case of the enlargement, it can also optimize it. So, if you are here, you have enlarged spleen or infection of the spleen, whichever one, and that really makes your white blood cells to not to work at the maximum level or to work the way it should be, and has caused you a lot of damages to your system. We have a product that can work on the root cause, of the problem, and this problem can be solved. And if you are not yet in this category, you can also optimize your health so that you will not fall a victim of an enlarged, enlarged spleen. Like I said, the one of the major causes of the enlarged spleen, which is malaria parasite. Superlife SC30 and SIC can treat the problem of malaria parasite, very perfect. I've said it. If you see anyone falling short of having malaria and typhoid fever every month, some people treat it almost every month, some people 2 months, 3 months, and quarterly. I've told you the best way to nip this problem in the bud is to combine SC30 with SIC. And I'm telling you, the problem of this parasite, malaria parasite, or fever or typhoid will be things of the past, because SC30 can activate your cells if they are dormant. It can optimize your cells. I think it can also regenerate the new cells. Then SIC also boost the immune system. And SIC, particularly for boosting the immune system, can allow your immunity so that even when you have a mosquito bite, the parasite will not form to become a disease that will really cause you a serious damage to your problem. So it can serve as a preventive measure for you if you have not fall short of these challenges. So, like I said, SC30 is a powerful product that has been tested and proven to have ability to work on any kind of medical challenges or health challenges that might be ravaging your system. Not only to treat them or to improve the condition, it can also prevent you. That's why we call it anti-UV, anti-radical, antioxidant. So inflammation, and the enlargement of the skin is also when the spleen is being enlarged. It's like the inflammation has taken place. There's a damage, which is that become a full-blown disease. So SC30 can help you because it is have ability to unlock the unlimited potential of your cells. and cells has the ability to self-renew itself if all things be equal. It is a combination of powerful ingredients, 9 ingredients that are put together. This Malus domestica, which is a rare Swiss apple, then solar vitis, like you see the function of a Malus domestica here. One of the powerful ingredients said it can reverse damaged tissue and organs. So if you have problem of enlarged spleen, which is the tissue, it can reverse it. It can protect your human stem cell against UV or light-induced cells. It can reverse environmental damages. If the problem is due to the environmental factors, it can also reverse, also promote cell regeneration, collagen increase, synthetic and repair of damaged cells, and stem cell regeneration rate. That's it. So we have the solar vitis as well, which is very powerful antioxidants as well. Then we have the black currant extract. We have glycine cantaloupe and glycine gliadin in form of the vitamin C. Then we have the black currant extract, the bilberry extract as well. Then we have the 3 additional omega-3 fatty acids, which is helping the body, because one of the functions of omega-3 fatty acids is to help the body for self-renewal of the cells and tissues of the body, and it helps in the healings of the body. It gives a powerful nutrient to the body for body to be able to renew itself and repair itself, because the body has the ability to heal itself. So we have the golden kiwi extract, which is a powerful antioxidant. Look at it. It is very high in anti-arthritis and anti-hemorrhoidal properties. Also, we have this prickly pear cactus, which is also powerful antiviral and anti-inflammatory properties. You can look at it, because one of the reasons for enlargement of the spleen can be a virus, like we have discussed. Doctor have said, it can be virus, and it can be parasite, it can be bacterial infection, or parasites or pathogens that destroy the spleen, that cause the enlargement of the spleen. Then it can be due to the liver also damage. And look at it. This ingredient prevent liver injury. So that is it. So it has antiviral and anti-inflammatory properties. And the enlargement of the spleen that means that there is an inflammation of the spleen. And this one has the anti-inflammatory properties. So it can reverse it if that happens, and it can prevent it if it has not occurred. Then the last thing we have is sick bottom, which is another powerful antioxidant property as well, has in high level of a regenerative and restorative effect to fight free radicals, that is unwanted molecules that leads to oxidation, and the oxidation leads to inflammation. So it can prevent and it can also reverse it. So, like I told you, SIC also is a very powerful combination. Then with a lot of ingredients. Then we have the SCC Plus also there, Super Life Column Care, also a powerful product. Look at it, support the liver detoxification to promote overred liver health. Like Dr. Rose told you that due to the problem into the liver, that was what resulted to inflammation of the enlargement of the spleen in some circumstances. It can also help for liver detoxification and also promote liver health. Help to protect constipation and promote healthy bowel. Help to maintain healthy gut microbiome, and that is a good bacteria, and promote growth of a good bacteria in the body. Help to cleanse the body metabolic waste and decrease the risk of cancer development. We talk about what do you call it? Leukemia, the cancer of the lymphocyte. So all these ingredients, helps a lot combined together to fight this problem, and you can be very assured that your health will be restored. This is SIC, combination of different kind of powerful ingredients. Look at it, support natural release of stem cell from the bone marrow. That's what we are saying, because every morning the stem cell leaves the bone marrow, cells leave the bone marrow to other parts of the circulating stem cell. And so this product has ability to help or to support the release of the bone marrow. And when this happens, every challenges in the body can be truly, treated or restored back to normalcy. Also, improve the symptoms of congestive heart failure, help to increase blood oxygen level and boost energy naturally. It helps to reduce blood sugar level by reducing the lipid and glucose level. These are the other functions. So, and it's a powerful high antioxidant properties, which is very, very important in the treatment of the enlargement of the spleen. So, I want to congratulate each one of you that's on Zoom tonight. If you have anyone that is suffering from this problem, I can rest assured that having listened to Dr. Rowe from Chilaka and also the presentation about our recommended product for treatment of the enlarged of the spleen, you agree with me that this problem can be totally solved using our ecosystem in Superlife without no side effect and with a very utmost effective treatment for restoration of our health. So, and also, like I said, we should not basically think about having the challenges before we think about what to do. These products also serve as a preventive measure for some of us that have not find ourselves in this scenario, so we can use it for prevention measures so that we'll be free from this kind of challenges in the near future. Thank you very much for listening live.
Thank you, Coach Sampson. Please, thank you. Yeah, please, if you have any questions, can you kindly drop it at the chat room? I want to draw our attention to our health manual. Please, that health manual is internationally recognized. You are going to see the prescription on page 65. On the page 65. So in that page 65, you will see the condition. Then you see the product to be used, which is STC30, SIC, and SCC+. Then you see the dosage and duration. I'm just reading from page 65. Please write it down for those of us that already have this manual. Or you just write it out in case if you get the manual. The manual is available, and we said between now and end of the month, there is a promo on it. It's a manual of 10,000 Naira, but we are making a promo of 5,000 Naira. We just extended it to the end of this month. So dosage stroke duration. You said SIC plus STC30 to be taken once daily for 12 to 18 months. And to 12 to 18 weeks, sorry. SIC, which is the Immune Booster Super Life Immune Care. STC30, Super Life Total Care, to be taken once daily for 12 to 18 weeks for both, for less severe cases. This one is for less severe cases. Why SIC and STC30 to be taken twice daily for both if they are if this one is really severe cases. You will be taking it twice daily for the real severe cases beyond the spleen to the level, and add that severe cases. Now you say you have to add SCC plus once daily for 2 months. That's 200 ml. I guess you understand the explanation. If it is a case that is not severe, it's just SIC and STC30 once daily. And you already know the mode of administration. If it is STC30, it's best taken early in the morning in an empty stomach. You pour it under the tongue and close your zip your mouth. That's my language. Zip your mouth. It must be in an airtight mood, so that the sublingual effect will occur within 10 minutes to 15 minutes. The one that's supposed to diffuse to your bloodstream, that effect will take place. Whereas the SIC, you have to mix it in a 200 ml of water, a sachet. You take it, it's once daily. But if the case is severe already, you use the same SIC and STC30 twice daily. Now, you have to add SCC plus, or once daily if the case is severe. Then you now say, remark, send for abdominal scan or CT scan at the end of administration. At the end of administration, meaning that before administration, we normally request, if you come to us to ask us this XYZ, we always request for your scan results or your test results. We forward it to our consultant. They will look at it. They will now confirm what therapy you have to go with. So after you have used our product, you go again if you sincerely obey it. In short, I want to let us know, as many that we obey the instruction or the method of administration, and you follow it religiously, then after the dosage, you have to go for another to see the level, the remarkable level of progress. The remarkable level of progress. So please take note on that. So having said that, then we want to add, please be guided on where you get our products. Any product of SuperLife that you did not get from us, you are at your own risk. Why? Because any product of ours that you are sourcing outside there is very dangerous. Even if it is coming to you free of charge, don't joke with your health. Don't joke with what will complicate your health. We are sounding that note of warning because a lot of report has come. And unfortunately, many who dive into those fake products, so many of them are no longer alive to tell the ugly story. It's just the few. So please be guided. Our product for now is not meant, we don't have any MOU with any pharmaceutical store or all these online social media shops. So you must get it from us. And hold us if after you have followed the procedure, if you don't see a remarkable result in your health. I can stand in as the director of this company. If we monitor it in that way and you don't get that result, no matter the health challenge, how severe, if you don't see improvement after the therapy, we will refund you your money. So please quote me. So having said that, then please, I made an update announcement at the beginning. Some of us didn't join, couldn't join at that early time. I said as from next month, July, we are going to start the second equation of our opportunity, SuperLife movement. We said the SuperLife is super health plus super wealth is equal to SuperLife. So we have been using every Friday, 8 p.m. to discuss about our health, which is the super health. And that is the mission of the company. That one is the key. Why? Because a lot of health challenges has overwhelmed the Western science. It has overwhelmed the Western science. The big hospitals in the world, all those terminal, they call it terminal MS, has overwhelmed them. So we are going back to the Eden, back to the origin, which is the nature. And that is what the plant-based stem cell has given to us. That's a paradigm shift via plant-based stem cell technology of SuperLife. So we are going back to the origin, which is the nature where God has asked man to be and to get this perfect solution. So having said that, then every Friday we still remain based on that mandate, so that as many people that are suffering all manner of health issues, whether cancer, whether stroke, whether spleen, whichever, sickle cell anemia, please, whether if you are the one having the issue, or you have your loved ones, or your friends, or your in-laws, please bring them to our table. Before now, God has provided all the necessary things that we needed. Look at the ecosystem. When this Super Life came up, it was only one product. But now this one product, which is the flagship product, already have other supportive, other ecosystem that will begin to deliver the results in a very record time. In a very record time, once you combine them. Look at the spleen, 3 products, more especially if it is already critical, severe. And look at the WHO consultant recommendation. If it is severe, twice daily, and you must add SCC+. That's the wisdom. And by the time you use it between 12 and 18 weeks, 18 weeks, not months, not 18 months, 18 weeks, go back for the scan results or test results. Even before going back, you will begin to sing hallelujah. You begin to thank God for this thing that they have already tell you is a death sentence, that God has provided a solution here. So you are welcome. So by next month now, we will now activate Super Wealth, because good health is wealth. That's the slogan we have been using. Health is wealth. When you are in good health condition, well, it's supposed to attract wealth. And that is what the Super Life platform has made to be real. We have been using that adage. Health is wealth. But no platform has ever translated it. Some platform will be giving you wealth. And at the end of the day, you will lose your health. Because when you are using that wealth to pursue the big hospital, the best drug, this, that, at the end of the day, the person will buy, God forbid. So, but now in Super Life, we are putting the cats before the horse before the cats. We are putting the horse before the cats, so that things works well. So that's why it's health first. Then that health will attract wealth naturally. You don't need to struggle about that. That's the reason why we talked about 80-20 golden rule. And this 80-20 golden rule, we will begin to interpret it as from next month. We'll begin to let you know, you that is hearing this now, possibly it's just your health that is giving you serious problem. You are not even talking about wealth now. It's how you can get your health. Now, by the special grace of God, this ecosystem is going to deliver your health in a very good manner, not in a very severe, painful manner. After which, now, their testimony and people that already know the health condition you had before will begin to ask you what happened. How did you get your health? Whatever. Then is now turning to wealth. So by next month, we are going to choose another day. And it's likely going to be on a Saturday. But we don't yet to decide whether Saturday in the morning or Saturday in the evening. But by next week, Friday, we are going to bring it on the table. That's the time on Saturday, so that we'll be talking about the 80-20% golden rule. How you are going to leverage on our 80% assistance, our 80% support. What is that 80% support? You are going to know it. And you are going to know what is that 20% commitment that is required of you. If I am you, even though that is not a must. But as far as you have come into the ecosystem of Super Life, that health is wealth. You will gain your health, and you will acquire the wealth will come with ease. So please look forward for that next month. More especially as from next week, Friday, that we are going to present the timetable, how it will be. So you are welcome. So I don't know if there is any question in the chat room. Is there any question there? So please, then those of us that are already at the rank of Crown Diamond and above, please make sure you fulfill all righteousness this month, before 30th of this month. Make sure you fulfill it. If you don't know what is that, please reach out to me. If there is any area you are having challenges, reach out to me so that we can assist you to solve it. Why? Because you cannot afford to miss the global profit sharing that is going to take place next month, July. And it's going to take place on or before 15th of July. You cannot miss that wonderful benefit. Being a shareholder of this company, we are going to leverage in what other countries that are doing marvelously well, more than even our country. We are going to leverage on what other continents that are doing marvelously well in Super Life, more than African continents. We are the profit that came to Super Life world globally. They are going to pull out a certain percentage, which is 10%, and they are going to share it accordingly from the rank of Crown Diamond and above. Now, somebody will be asking, what is that one all about? These are the things that will be discussed as from July. As from July, we are going to have a day, which is Saturday, different from Friday. This Friday health seminar will continue as it has been going, but it's going to be going on simultaneously on Saturday. That wealth side of it will come up. So those of us that have started enjoying health or whatever, you want to be part of the wealth side of the Super Life, please, you are highly welcomed. You are highly welcome. We are going to take it from A, B, C, D to take you to the ladder of the Super Life wealth platform very effortlessly. As you are helping to solve the big problem of humanity, you will see how the company will be leveraging on the ecosystem of the company, and you will be compensated handsomely, all of us. So please, the Crown Diamond and above, don't miss this wonderful profit sharing. Thank you. And of course, you have paid the dues to be a rank of Crown Diamond. And so many of us that are desire to enter the rank ladder, please, you can reach out to me. Take advantage of this coming next month, that every Saturday will be for the wealth side of the business. Every Saturday. So thank you very much. I don't know. Coach Sampson, do we have any question? Hello, Coach Sampson, are you there?
No, sir.
There's no question.
No.
I want to return the platform to Prof. Ebe. Prof, are you there? Hello, Prof. Okay, please. I want us to appreciate, keep on showering prayers to Prof, to Farmer Chilaka, to Dr. Chooks. Dr. Chooks, I'm always engaged with him on a daily basis. So he will always be having a conference call with some individuals. So please, if you have any case that you need a consultant, it's a free consultation free. You will have opportunity to have a personal conference call with Dr. Chooks that will now help you to provide solution to whatever the case may be. So we have a lot of professionals with us. So thank you very much. In absence of no question, please can you just open our mic so as to share the grace in fellowship. Are we there? Want to go? May the grace of our Lord Jesus Christ, the love of God, and the sweet fellowship
of the Holy Spirit
be
with us
now forevermore.
now and forevermore. Amen.
Surely God's goodness
and mercy shall follow me
Mercy shall follow
all the
us
days of my
all the
life.
days of our lives.
of our lives.
And
I
we
will
shall dwell in the house of the
forever
Lord
and ever.
forever and ever.
Amen.
Amen.
Super life.
Life is super.
Remain
Good
super.
night, everybody.
Thank you.
Good night, good night, good night.